Cool. Well, thank you, Congresswoman Schrier, for joining us. We are the Washington State Association of Head Start and ECAP. We're a C3 organization that represents Head Start and ECAP providers, parents, and staff, and of course advocates for the children that are enrolled in these programs. And we're delighted that you're joining us tonight. This is a series of candidate forums that we've been doing. They're approximately 30 minutes in time. We have a set series of questions that we've been asking each candidate. If we have some time at the end, we will open it up for some of the attendees. And again, I'm Joel Ryan. I'm the Executive Director of our Head Start ECAP Association. And it's truly an honor for me to be able to give you an opportunity to participate tonight and partner with us. So we're delighted, and thank you to everybody else for, I see we have a few folks that have joined us as well. So thank you for joining us. We wanted to start out first, Congresswoman, to simply say, if you could just introduce yourself and share a little bit about why you decided to join a forum that was specific to families with young children. And thanks again for joining us.
Thank you, Joel. Well, boy, I mean, it's hardly a question as to why the first pediatrician ever in Congress would want to join a town hall or conversation about children, early childhood education. This is right up my alley. I ran in good part because I was worried about our country under the current administration and what that would mean for children, everything from public education to civil discourse or the lack thereof to healthcare. And so ran, and I think that really resonated with a lot of people and a lot of families. And so it has really been my mission in Congress to be a voice for children, whether that is in healthcare, whether that's from my position on the Education and Labor Committee, going to bat for early childhood education and affordable childcare, and for healthy school meals and WIC, or whether that's from my committee on agriculture and working to end hunger through the SNAP program. But I'm delighted to be here and always to be a voice for children.
Well, thank you very much. I'm going to turn it over to Yuval, who's going to start us off with our questions.
Thank you. So our warm-up question for you today is, since our forum is focused on young children and families, what was your favorite children's book growing up and why?
My favorite children's book growing up, I think it was something called like The Little Girl. It was something very creative like that. But my favorite children's book now that I'm a parent and I've gotten to read a ton of children's books for young children, All the Frog and Toads. Love them.
Thank you. So our next question is, what is your definition of early learning?
Well, for me, early learning is what happens before kindergarten. And ideally, we would have early learning all the way from, 0 to launching to kindergarten, but at least getting those 3 and 4-year-olds kindergarten ready, getting them to have the social skills that they need, not through academics, but through play and learning through play and learning to work together, cooperate, take turns, you name it. But early childhood education, that's really early. And frankly, it involves parent education at the same time.
Thank you. Our next question will be asked by one of our parent leaders, April.
Speaking of those 3 and 4-year-olds, research shows that investments in comprehensive early childhood education pays off, particularly for disadvantaged children and families. Head Start is one of those high-quality comprehensive programs serving the most at-risk families. Do you support increasing funding for Head Start? Why or why not?
I absolutely support increasing funding for Head Start. I absolutely support Head Start and what you do for families and for children. And I am happy to say that in the last couple funding seasons in our appropriations, we have increased funding for Head Start. So yes, it is a priority. Not just that, I have a family member who is connected to an at-risk child, and I have suggested that they get her into Head Start as soon as possible, as that extra set of eyes and a support for her mother.
Thank you. So many children attending school online due to COVID-19 has shown us the inequities and inequality of opportunities in the public school system. What will you do to address these issues?
Well, there are a million things to do. I mean, even before COVID, there were a million things to do to address inequities in our school system. Look, our schools are funded in a very backwards way. They're funded based on property taxes, which means that if you live in an area with big, expensive houses and lots of property taxes, then your schools are well funded and good. And if you live in an area with lots of apartments or a rural area that really doesn't have homes, and then your schools are chronically underfunded. And states make up some of that difference, but they don't make up all of it. And so, we can start with something called the Rebuild and Relaunch America's Schools Act that we passed in the Education Committee, where we would allocate resources first to Title I schools, so the schools that are most in need, for reparations of the schools, for rebuilding schools, for making it so that there is digital access and good ventilation and good heating systems, to make an environment conducive to learning, because learning needs to happen in the classroom first. And then we can talk about what happens outside of school, things like the digital divide, parent support at home, after school programs that have not just care, but access to tutors and homework time, because we need to support our students, particularly the ones in the Title I schools and for children who don't have that support at home.
Thank you. April will ask our next few questions.
Speaking of healthy children and families, how do you plan on increasing access to families with young children in need of quality, affordable health care, especially during the pandemic?
Well, the pandemic's really highlighted everything that is wrong with our healthcare system. You can see which communities are most impacted: Black and Brown communities, getting sick more often, getting more severely sick and hospitalized more often, and dying more often of this disease. For a variety of reasons, but some of that it just stems from either chronic stress or lack of access to regular care. So we need to intervene on multiple levels. And I'll tell you one of the things that I've done just recently, a few bills. One of them is increasing reimbursement rates for Medicaid, so that children with Medicaid have a bigger range of doctors that they can choose from, so that every child can have a medical home and a trusted provider that knows them well and sees them when they're ill and when they're healthy. Another one was that I worked with Lauren Underwood to make it so that the first 3 mental health visits and the first 3 primary care visits would not count against a deductible. You would have a copay and that's it. The idea being that we don't want that deductible to inhibit people going and seeing their doctor. And most people only see their doctor a few times a year anyway. And this makes sure everybody gets the care they need when they need it, and that mental health needs don't go unmet. So those are some of the ways. And of course, expanding Medicaid, something that was part of the Affordable Care Act. Lots of states didn't take advantage of it, and they have really paid the price by having an underinsured population. So in our recent ACA enhancement bill, we essentially mandated Medicaid expansion in all the states. That will help our disadvantaged population.
Great, thank you. My next question is on childcare. Childcare providers are some of the lowest paid workers, often making less than parking lot attendants and dog walkers in many instances. What will you do to make childcare more affordable for families and increase wages and benefits for those workers?
Right, so this is one of the big conundrums of our time, right? That we all want affordable childcare. Right now, lower income families spend 35% of their income on childcare. And right now, if you have an infant in childcare, it costs somewhere around $1,000 to $1,500 a month. Which means that once you have 2 children, basically somebody is just giving up their job, because there is just no economic sense in having that. And now during COVID, we're seeing what happens when childcare providers aren't even there. They're closed, and our entire economy tanks because of it, because we lose half our workforce. Not to mention the stress that it puts on single parent households, most of which are headed by women. There are many things we have to do. We already can't afford childcare. So simply saying, oh, we're just going to raise wages, we're just going to pay teachers more, we're going to have more education opportunities and better benefits, that does not work. Like, this is a system that is not going to work in a purely capitalistic system. It just doesn't pencil out. One adult takes care of 4 babies. There is no way that those 4 people will be able to pay for the overhead and the full salary of that one provider. It just doesn't pencil out. And so that's why we need robust public investments in 2 ways. Some of that should come directly from the government to the childcare provider. If you send all of the money straight to parents and say, take it wherever you want and spend it, it still leaves a childcare provider with a high degree of uncertainty about whether they can afford to stay in business. Because if just one parent leaves, all of a sudden that salary has been cut by 25%. So we need some support on both sides, part to the providers associated with standards in education and safety demands, and on the other side, either subsidies for parents or tax incentives for parents so that they can afford to have their children in good, high quality care while they're at work.
Thank you.
Yeah, thank you.
Our next question is, only 5% Washington state eligible families receive home visiting from federal, state, and local funding, leaving families unserved. Are you going to work towards expanding policies around paid family leave, early Head Start, and home visiting?
I support all of those programs. And in fact, was in an interesting conversation just yesterday with community-based child abuse prevention. And they said that their services are available to everybody. Like, flyers go to every new parent, for example. But although they are seeing increases of the number of people who take advantage, there is still more that should be available. And so I would absolutely increase funding. I did that through CAPTA, the Child Abuse Prevention and Treatment bill, and also through Head Start and Early Head Start.
Thank you. April will be asking the next question.
Prior to COVID-19, 1 in 11 children were homeless. Due to the pandemic, we've seen an increase in homeless children and families. What will you do to ensure children have safe and stable housing?
The 1 in 11 is a stunningly high number. 1 in 11. Housing affordability, homelessness, these are really important issues to address, because students without a home, without stability, students with ACEs, the adverse childhood experiences, are set up for a far more difficult life, not just academically, not just right now, but for their full life and with health effects later on. And this is something that we can solve. The low-income housing tax credit is one of the most straightforward ways to do this, where you just incentivize the creation of low-income housing. Right now, housing anywhere in or around Seattle is simply unaffordable. And that should not be the case, in particular now that we have empty hotels because that industry is underwater. This seems like an ideal opportunity for government, state government in this case, but with federal assistance, to buy a couple hotels, to transition those into apartments, because families should not be living in their cars, they should not be couch surfing, and they certainly should not be out on the street. And we can and must do better, in particular when these are families with children.
Thank you. Our next question is, nearly 1 in 5 children do not get enough to eat in the US. What is your plan to ensure all children and youth get the nutrition they require?
Well, as I mentioned in my opening remarks, I specifically joined the Education and Labor Committee and the Agriculture Committee because I get to work on hunger in both of those. Look, the most straightforward, best thing that we could do is just increase SNAP. Increase SNAP benefits, increase access to SNAP, take away draconian work requirements, and make sure that SNAP also can be a little bit prescriptive in which foods you can buy, so that we really incentivize fruits, vegetables, the outside aisles of the supermarket, because what we really want is not just to feed people, but to nourish people, and to make sure that we make investments now that will pay off later in terms of fewer chronic diseases. And so I would expand the SNAP program and loosen eligibility requirements, because this is not an area that is subject to fraud. This is getting food to people who are hungry that will make them better workers and better students. Since that is not something that is that is realistic when we have two parties battling this out, I've done other things. I worked with Jamie Herrera Butler to make it easier to get WIC benefits during this pandemic, so you wouldn't have to have in-person interviews. Also, an expansion with an extra $35 a month for fresh fruits and vegetables. And I continue to work with Food Lifeline and other hunger organizations, Feeding America, to make sure we combat this. Lastly, right now we are seeing record numbers of families who are facing food insecurity. And we're also seeing farmers who have lost their supply chains. The restaurants are closed, they're not selling to restaurants, the schools are closed, they can't get food to the cafeterias, cruise ships are not, there is nowhere to send this food. And so I have a bill together with Kathy McMorris Rogers called the Farmers Feeding Families Coronavirus Response Act. And this bill gets money to states so they can simply buy that food from farmers who would otherwise go under and get it to the local food bank. And that solves two problems at once. It keeps our farmers afloat and it helps families in need. So those are some of the ways that I would help.
Thank you. I know earlier you mentioned similar things to after school programming. So this question has a little bit to do with that. How will you ensure that all children and youth have access to high quality, safe, and supervised before school, after school, and summer programming?
This is simply funding that comes from the state and the federal government. And I know that for some areas, parents pay for that service, but for children from families with economic hardship, that is a free service that is provided. And in areas where there are a high number of students in need, that becomes a free service for all of the school, just like community eligibility for food programs in the schools. Our schools, our public schools, are the biggest childcare providers in the country. We think about the word childcare and we often think about the little ones. But the reality is that without those before and after school programs, you could not have both parents working or single parents working and also have their children in school. So this is important for academic success and for safety and security.
Thank you. And thank you for hanging in there with us. And so Joel will be asking our last question before we open up for Q&A with the audience.
Well, I was just, I think for the last question, what I'm curious about is around the Affordable Care Act. And, what would you do to increase the number of children and families without health insurance or underinsured? What would you do to increase access for those families?
So we've already made several changes that would shore up the Affordable Care Act, increase affordability, and make sure more people are covered. We saw dramatic drops in the number of uninsured when the Affordable Care Act was first put into practice. I mean, here in Washington State, it went down into, I think, the 5% range, which was a tremendous improvement. So we need to do more of that. There's several things to do. First, of course, is Medicaid expansion. That addresses people at the lower end of the income spectrum where insurance would mostly be out of reach. So that's a no-brainer. The next one is what we did in the Congress with the Enhancement Act, which was simply saying, look, we're going to cap premiums at 8.5% of income. And that would immediately, for the average family of 4 in my district, that would cut their premiums in half, from about $17,000 a year to about $8,500 a year. That is not a little nibble around the outside. That is a tremendous change that would make healthcare affordable. So those are some of the ways, certainly 2 good ways to start. I would add that bringing down the cost of prescription drugs doesn't just help the people who take those prescription drugs, it helps everybody. Because when insurance companies are on the hook for paying crazy prices, $300 for a bottle of insulin, that affects us all, and we all get gouged. And so taking on the issue of exorbitant drug prices will help healthcare affordability across the board.
Thank you. I think for our last question is on the relief package that Congress is considering. I know the president has decided not to negotiate further on that, according to the media today. I'm curious to know, though, do you support another relief package? And if you do, what would be your top 3 priorities within that relief package?
I absolutely support another relief package. I voted for the HEROES Act back in May. I voted for the second HEROES Act just this week. My top priorities, number 1, and it might surprise you, is state and local funding. Because I talk with the mayors in this state and they all say, look, get us the money. We will work on rental assistance. We will work on getting food to people. We will work on, bolstering them and setting up our schools for success. And so I cannot overstate the importance of state and local funding. And that seems to be a big roadblock right now. The second one is to bring back the enhanced unemployment so that families who have lost their jobs for no fault of their own can just keep afloat, can still hopefully pay their rent or their mortgage, put food on the table, and keep afloat. And then third, it's kind of a tie between cash assistance or shoring up funding for testing and tracing and the public health elements. But those are top priorities.
Well, thank you. Before we open it up for questions from the folks on this Zoom call, is there anything you'd like to just close with?
Well, I feel like it's closing prematurely if people have questions, but I would just say that it's very, it's been an honor to represent the 8th District for these past 2 years. I'm a newer member of Congress. I'm part of the wave of women that came in 2018 in response to a lot of what was going on in our country. And it's been a real opportunity to lead, and particularly this term, to bring the voice of a doctor and a woman doctor and a pediatrician has been incredibly helpful at a time when people are hungry, when children need support, when families need support, when we're dealing with a pandemic. It's been really an honor to be able to bring my voice to these issues.
Cool. Well, thank you very much.
Thank you for the review.
Yeah, thank you.
For inviting me.
Absolutely. Why don't we see if there are any questions at all? If you have a question, I think you can just unmute yourself.
This is Jess. Can you hear me?
Yeah.
We can hear you, Jess.
I don't have any dying questions, but I just want to express my gratitude for all the work that you have done so far in the short period of time that you have been, and the work that you've done for children and families. And I am your constituent, so I really appreciate you.
Thank you. Great to see you, and it's my pleasure.
Well, if we don't have any further questions, we will close this forum. Jess, I don't know why I'm just staring at you, but that's how I guess that's how the forum is. What we are going to do, though, is we've recorded this candidate forum, and we will send it to you, Congresswoman, so your campaign can use it any way it would like. We're also be posting it on our Facebook page and sending it out to our members as well. So really appreciate it. Thank you for joining us tonight. It was great to have you.
That's great. Well, thank you very much. Pleasure to talk with all of you, and thank you for the work that you do to help our children really meet their potential.
Thank you.
Well, thank you.
Thank you so much.
Thank you.
Yeah, take care.